Hello again, everybody. Today is, it's actually my birthday, 24th birthday. Happy birthday to me. But that's not important. Today is day 15 post-op, week 2 in a day. Got this horrible splint that comes up fairly high that I gotta wear for the next 3 weeks, which it's not too bad, I guess. Only 3 more weeks. I take it off every 2 hours to do some exercises where I pump my elbow up and down, twist my wrist, which is kind of a pain because there's 100% something wrong with my left wrist, but it's not too painful, just kind of clicks a lot. I'll get that fixed in a few months after my right arm and right wrist. I have my second occupational therapy today in about 2 hours. My mother will drive me. My mom and dad have been a great help. Thank you, Mom and Dad. I'll have to get them a nice gift after this is all said and done. I was supposed to return to work yesterday. I tried working. It was pretty excruciating. So I talked to my boss and I explained my full situation to her. I'm going to have the right elbow done pretty soon. So she literally said, I'll give you till the end of January off, which was extremely kind of her. I did not expect her to say that. So thank you, Allison. Of course, I'm part-time though, so I'm not getting paid regardless, but honestly, don't really care. The most important thing to me is my health right now and getting these elbows and wrists fixed. I have been watching a bunch of movies, mainly movies I've seen before, though right now I'm watching one I haven't seen before, The Greatest Beer Run Ever. That you guys don't care about that. I would show my scar, but I just did my exercises a bit ago and I don't really want to take this thing off and go through that right now. It's definitely scabbing over, a lot of dry blood around it because it hasn't been soaked or washed. They told me not to wash it yet. Not quite sure when I'll be allowed to wash it, but I look forward to that because then I can actually see the true progression of the scar, but it is definitely scabbing over quite a bit. The actual scar doesn't hurt near as much as it hurt a week ago today, though this stupid splint is pretty hard and it definitely puts more pressure on the scar than I would like, and it hurts quite a bit. There's some general tightness in my elbow, but I can actually get it to like here about and extend it like, it's a terrible angle, but extend it like this. It goes about to here. Not quite 180. I'd say it's at like 160 it probably gets to. Yeah, definitely seen progress. The wrist basically moves. I almost have all the function of the wrist back, and the fingers, they're a bit weak. I can tell they're weak and a bit stiff, but they definitely feel a lot better. I feel some occasional tingling in the fingers and in the elbow. Sleeping is a pain in the ass. I'm sure all of you understand that who have gone through this, and I'm sure sleeping will be difficult for the next, really until this scar heals up, and then once I do my right elbow and my right wrist, I'm sure sleeping will be difficult until the right elbow heals up. I've tried a bunch of different positions. Sleeping, I generally will sleep on my right side with my arm propped up on a bunch of pillows, but that's kind of uncomfortable. Don't really enjoy that. I think I'm going to try sleeping on my back, which I'm terrible at sleeping on my back. I've never really been able to fall asleep sleeping on my back, so hopefully I will tonight. We'll see. Yeah, I feel like in terms of range of movement and all that, I'm getting along pretty good. The swelling has definitely gone down a good amount. Not a ton. It's still fairly swollen, and I'm sure that over the next 2 weeks will subside a fair amount, a lot, but I mean, it definitely will take months for all of the swelling to go away. There's some clicking in the elbow, which I've been told is most likely scar tissue breaking up. I don't think it's the nerve, because when I bend, I don't feel the nerve moving around. I'm pretty sure the nerve is in its new spot still, which is refreshing. But I'm feeling better. I'm sure I'll feel much better next week. I'll post another update next week, and then I'm sure the week after that I'll feel even better. And then the week after that, on Tuesday, the Tuesday after Thanksgiving, is my follow-up with the surgeon. And then I guess we'll probably schedule the surgery for my right elbow soon after that. I'm not sure when it'll be. My guess is mid-December would make sense. So I'm thinking mid-December I'll probably have the right elbow and right wrist done. And then I don't know how that recovery will go. I'm sure it'll be a bit different because I'll hopefully be doing my right wrist at the same time. But if not, then it'll be the same recovery, and then I'll just do my wrists separate. But yeah, I just wanted to give an update as to how I'm doing. Feeling pretty solid. Glad I don't have to work for the next 2 months. Although I thought it would be a good distraction. It wasn't. It just made all the pain worse, especially in my right arm. But it's just, this splint makes it impossible to sit literally anywhere comfortably except in a bed with it somewhat supported by some pillows. The splint just makes it makes my elbow drive into anything that I'm sitting in, or I have my shoulder hanging if I'm sitting in like a normal chair like that. I have my elbow like hanging, or my shoulder hanging, and then the whole arm hanging, and that's just extremely uncomfortable for my shoulder. So I've kind of been chilling in my brother's room in his nice queen bed. It's not that comfortable, but it's better than my tiny twin bed. I go out for walks with my dad and my dog quite a bit, walk around the house a lot, pacing, which I can tell annoys my parents. They say you pace too much, but I've always paced. But yeah, I'm definitely feeling better. The scar definitely hurts less than it did last week today, which is when I got this splint put on me for the first time. Still have the steri strips on. They're not really falling off on their own. I can tell they're starting to peel a bit, but the occupational therapist told me that most likely they'll just take them off because they don't really fall off on their own that often. I'm still not supposed to soak the elbow, the scar, so no hot tub for me, which doesn't matter because we don't own a hot tub. But I'm not supposed to like just stick it under the water in the shower, but I can let water run over it and let soap run over it. Most of the pain I'm experiencing, if I'll be honest, is kind of like right here, of course, in the left arm, and it kind of goes along the back side of the elbow or the arm up until the pinky. The hand doesn't really have much pain at all. When I sleep, the splint kind of pushes into the nerve, I can tell, and that definitely causes some nerve sensations, but it's okay. It's not too bad, but sleeping is a pain in the butt. Yeah, I'm feeling better. Got my appointment with my occupational therapist today. So we'll see what he says, how I'm doing. Looking forward to that massage. That's the best, the massage. Hopefully break up more of the scar tissue. And I'm going to ask him about I'm going to ask him if I have to wear this splint at all times for the next couple weeks, or if there will be a point where I'm allowed to take it off for extended periods of times. Currently, I was told take it off when you shower, of course. Take it off for like 20 minutes at a time every 2 hours when I do my exercises. But yeah, I'm feeling okay. It's going to be a long process. I realized that a while ago, and I've accepted that. Obviously, I have to. But yeah, I'm looking forward to next Tuesday, where I'm sure even more of the swelling will have gone down, and the scar will probably have scabbed over completely by that point. It's definitely closed. I can tell it's closed, but it's not amazing. And next week I'll make another video next week, and I will actually show my scar and how it's looking. Hopefully all the dry blood will be cleaned off it at that point. I don't know. Again, I don't know when I'm going to be allowed to actually clean up or like wash the site of the incision, the scar. But I'm excited for that. That'll be great. I can't wait to just put my arm under some hot water. That'll probably feel amazing. But yeah, I know just taking some Advil every 4 or 5 hours, usually take about 800 to 1,000 milligrams a day, just for the swelling, and it kind of helps with pain, not a ton, but it definitely helps the swelling go down. And I'll probably continue to take Advil for the next week consistently, and then after that, I think I should stop. I looked up on the internet, and it says you shouldn't take Advil for more than 30 days in a row, and I've been taking it now for about, I guess 14 days, because it's 2 weeks. And I started with the high strength Advil. So yeah, that'll be about 22 days. I'll probably stop next Tuesday taking the Advil. But yeah, I'm feeling good, feeling better. Excited for the next couple of weeks to go by, and then not have to wear this god-awful splint on my left arm. At least I'll have to eventually wear one on my right arm. But yeah, I'm feeling much better. Feel the nerve tingle right now above. One of the only things that's really keeping me sane right now is the fact that I can feel the nerve tingle above the medial epicondyle, which makes me realize that it's still in that spot, because I'm very anxiety ridden, as I'm sure many of you are or have been, about if the nerve is still in its spot, not back in the stupid cubital tunnel, which I would like to say the human elbow is a mess. What an evolutionary fail the human elbow is, and the human foot, but that's beyond the point. Yeah, anyways, I'm feeling okay. Hopefully next week I can give even more positive of a review. Hopefully I'll feel way better. But yeah, I will check in again or post again next Monday and or Tuesday. It really depends. Probably next Monday. Yeah. just gonna continue this movie I'm watching. All right, see you guys.